now Psychiatry and Nursing. As a participant of the 6th Annual Virtual Georgia Wellness Conference, I'm bringing you a presentation entitled Every Mind Counts, Addressing the Mental Health Crisis and Exploring Resources in Georgia. Objectives for this presentation. Summarize global mental health trends from the World Health Organization, also referred to as WHO. Compare anxiety, depression, and care access by age, gender, and region. Identify major barriers to mental health in Georgia. Highlight a key policy issue shaping Georgia's mental health system. Analyze key data for NUMNI, which is National Alliance on Mental Illness. Review resources for NUMNI and Georgia Department of Behavioral Health and Developmental Disabilities, also known as DBHDD. Discuss wellness strategies, crisis resources, and disparities in mental health care in Georgia. Mental health has impacted the globe. According to the World Health Organization, it is an emerging public health crisis, and over 1 billion people worldwide have experienced psychiatric conditions such as depression and anxiety. Anxiety can be described as a complex or subjective experience. Understanding subjective means it is the individual's personal experience that may differ from the next individual experiencing anxiety. Anxiety may be marked by distress, which could be excessive worry, excessive fear. There may be physical symptoms that go along with anxiety, such as increased heart rate or rapid breathing. Anxiety is often triggered by threats that are not perceived or understood by the individual, which simply means the individual does not know what is causing the anxiety. Depression is a persistent state of sadness, hopelessness, or loss of interest. When we think of loss of interest, this is someone who generally looks forward to hiking, but no longer enjoys hiking due to the depressed mood. Depression may or may not include fatigue, but regardless whether fatigue is a symptom, the individual's daily functioning can be impaired because of the sad mood and the hopelessness. This is the individual who is struggling with occupational and social functioning. Expanding on anxiety and depression around the globe. According to the World Health Organization, anxiety is the most common mental health disorder, affecting about 359 million individuals. Depression comes in second, with a report that 280 million people suffer from this disorder. Although depression comes in second, it's imperative that we note it is at the top cause of disabilities among mental health disorders. These individuals significantly have disrupted lives. Research indicates that there is a substantial overlap between depression and anxiety, with about 50% of those diagnosed with depression also experiencing an anxiety disorder. So thinking about depression significantly disrupting daily lives, the loss of interest, the hopelessness, possibly fatigue, coupled with anxiety, the excessive fear, worry, increased heart rate, unable to determine where the feeling is coming from, and understand the impact of those two disorders overlapping alone. Zooming in to the United States, according to the National Institute of Mental Health, approximately 1 in 5 Americans have experienced an anxiety disorder, and about 8%, 1 in 12 adults have experienced a depressive disorder. Looking at the national differences in anxiety and depression, you'll note that women are more likely to experience anxiety and depression. This chart represents anxiety and depression rates in the U.S. youth by age group. Let's take a look at the bottom where you see the legend. And there are two key insights I want you to take from this chart. Ages 3 through 17, that includes our preschoolers, our kindergartners, our grade school children, and our adolescents. Notice about 11% experience anxiety and 4% with depression. The second key insight I want you to take away from this chart is the older the child, the more likely they are to experience anxiety and depression. And if you look at ages 13 through 18 here, look at the gray bar, you'll notice 32% of those individuals experience anxiety. A question may come to mind. If mental health impacts the world and is widespread in the U.S., what makes Georgia's mental health crisis unique? Let's talk about it. Georgia consistently ranks among the poorest states for mental health care access. According to a report from Mental Health America in 2024, Georgia ranked 46th out of 51 states, including D.C. Georgia has provider shortages that are significant, cost concerns, insufficient support systems, which leave hundreds of thousands without mental health care access. These system barriers may contribute to the persistent crisis, untreated mental illnesses, as well as elevated rates in suicide. This slide focuses on adolescents' access care in Georgia. According to a report from NAMI 2023, 68% of the adolescents were not able to access mental health care. That's nearly 7 in 10 adolescents. Research from NAMI 2025 reports that the recommended ratio for one psychologist is for every 500 students. Georgia has one psychologist for every 2,077 students. Continuing the conversation about access for our adolescents, keep in mind that 159,000 adolescents experience depression each year, and approximately 113,000 have serious thoughts of suicide. This information comes from a NAMI report in 2025. Shifting the focus to our adults, NAMI 2025 also reported that 475,000 adults were living with serious mental illnesses. About 410,000 reported serious thoughts of suicide. This chart illustrates data taken from the U.S. Census Bureau 2020 and 2022. It highlights the demographics and uninsured rates in rural Georgia counties. We have 3 rural counties listed here compared to Georgia's average as well as the U.S. average. And the key takeaway from here is that the uninsured rate is higher in the rural counties than it is to Georgia's average as well as the U.S. average. Another disparity is in these specific counties, you will notice that these three counties are predominantly African American. Barriers to mental health care in Georgia are provider shortages, as we reviewed earlier, high uninsured rates, stigma and cultural barriers, rural access gaps. Of note, over 60% of Georgia rural counties lack a participating psychiatrist. Addressing the pink elephant in the room, recent data from NUMNI 25 reveal approximately 1.8 million individuals living in Georgia struggle with mental health. Additional information conveys full expansion of Medicaid could possibly cover an estimated of 400,000 more Georgians. Yet Georgia has not fully expanded Medicaid. This slide demonstrates Kentucky's improvements of mental health access in 2014 after they fully expanded Medicaid. You'll also note that there was an increase in coverage for hundreds of thousands of adults, and their uninsured rate dropped from 20% to 7%. According to the Georgia Department of Behavioral Health and Developmental Disabilities, Georgia is building new state-funded crisis centers across the state. These centers will provide 24/7 mental health assessments, stabilizations, and referrals. The goal is to make sure that individuals in crisis get immediate help and support close to home. Georgia's Department of Behavioral Health has spearheaded a new 988 advisory construction committee. This is in response to high rates of suicide among construction workers in Georgia. Approximately 743 construction workers completed suicide between 2017 and 2021. The committee will include individuals from the community, from the construction workforce, mental health professionals, and other individuals. The suicide rate is higher at 165% compared to other individuals in the Georgia workforce. One of Georgia's recent highlights is New Hope Augusta Behavioral Health Crisis Center. It opened approximately May 2026. It is considered state of the art in Georgia and expands crisis care for the region. It offers 24 crisis stabilization beds, 16 observational chairs, and serves up to 40 people at a time. It replaces an older but smaller unit and brings $23 million in new state funding for mental health. It is expected to decrease the burden of mental health for individuals, families, and first responders. Reviewing Georgia's resources. What is NOMNI Georgia? National Alliance on Mental Illness. It's Georgia's organization supporting individuals and families that are affected by mental illnesses. Shifting our attention to the transit population in Georgia. According to NUMNI 2025, more than 12,000 individuals are homeless. 1 in 6 of them struggle with mental health. So we understand that every individual that's homeless is not in a homeless shelter. But imagine a homeless shelter with 18 beds. According to statistics, at least 3 of them would be homeless. Homeless people experience struggles with mental health. In addition, the barriers are real for them as well. There's no transportation for them. This is the individual that's less likely to have access to telehealth, financial burdens, and more. Numney, Georgia offers an array of resources for individuals with mental illnesses and their family. Support, which are free peer-led support groups, evidence-based classes for individuals with mental illnesses. They promote better mental health policies and care. They also have resources to crisis lines and local services. Numney, Georgia also offers community engagements, which reduce the stigma of mental illnesses. Mental health wellness is for everyone, whether you have a mental condition that is diagnosed or not. One way to be the gatekeeper of our mental wellness is to do daily self check ins. We can ask ourselves questions. How are you feeling emotionally? How are you feeling physically? Do you feel overwhelmed? Are you able to cope? There are techniques to decrease our stress, such as deep breathing, and we will cover that later in our slides. But if you're unsure to any of those answers, reach out for help. You can call or text 988 for immediate support. 988 is not exclusive to suicide hotline. It is for help when you are in crisis. Numney recommends an excellent resource, Sage Surfer. This is a way for you to do your self check-ins. It allows you to track your mood, access community resources, search provider services based on your needs, communicate and collaborate with personalized care team members, and it is private. You can also receive motivational messages and manage your daily activities. So I'll give you a second to look at the slide. You can scan the QR code here. Make sure you take attention to the registration steps, and it's important. I did try to download it for myself, and you'll need to put in the Numney, Georgia information under company name and use the SAGE code. Numney has several crisis contacts, which would include your crisis line 988, as well as Georgia crisis line and more. So this is the QR code for Numney crisis contacts, and it'll take you straight to the page, and I'll give you a few seconds to scan that. This slide illustrates directives on deep breathing. As promised, we are returning to this slide. Remember earlier, mental health wellness is for everyone, whether you have a mental illness or not. We also talked about daily self check ins. Before beginning these exercises, you want to reach out to your healthcare provider and get cleared. from them. So you want to remember the numbers 4, 4, 4, 4. So four times. And you'll see why in a minute here. To begin, you want to be in a quiet room. Sit comfortably. You may or may not close your eyes. It is up to you. Inhale slowly through your nose for a count of 4. Hold your breath for a count of 4. Exhale slowly through your mouth for a count of 4. Repeat 4 times, focusing on your breath. There are several resources on YouTube. There's actually a resource from Numney, Texas. If you would type it in, Numney, Texas, breathing, deep breathing, then it will come up. Okay, so just once again, get clearance from your healthcare provider and review these steps before beginning these exercises. Numney issued a recent report which conveyed 1,624 Georgians completed suicide. This slide gives warning signs for suicide. This is for you when you're doing your check-ins, and this is also for individuals that you may work with in the community, as well as individuals around you or anyone that you see with these signs. Talking about wanting to die or expressing feelings of hopelessness. Withdrawing from friends, families, and activities. Showing extreme mood swings or sudden personality changes. An increased use of alcohol or drugs. This could be someone who is attempting to overdose. Giving away prized possessions or saying goodbye. Expressing feelings of being a burden or having no reason to live. So what do we do? What do we do if we notice these signs? Make sure we're taking all of the warning signs seriously. Encourage connecting with mental health professionals or crisis resources. So if it's you, then you reach out to your mental health profession or crisis resource. Offer support if it's not you. Ask for support if it is you. If you're unsure, call 988. Okay, we've had a lot of talk about the 988 crisis line. It is a 24/7 non-judgment support line. It is for mental health, also substance use, and more. Remember, if you're in doubt, call 988. And you have the QR code on the screen. And I'll give you a second to scan that. The next slides are references for this presentation. Thank you for listening to this presentation entitled Every Mind Counts, Addressing the Mental Health Crisis and Exploring Resources in Georgia. Again, my name is Tabitha McJunkins. I am the Chief Psychiatric Nurse Practitioner of Act Now Psychiatry and Nursing. Email us for questions, go to our website, and you can also follow us on Instagram. And here's a QR code. Thank you again.